A hematocrit is a simple and informative test that may be performed by the medical assistant. The hematocrit measures the percentage volume of packed red blood cells in whole blood. A hematocrit reading that is below normal may indicate anemia, and a hematocrit reading that is above normal may indicate polycythemia. The hematocrit, in conjunction with other hematologic tests, helps the physician diagnose a patient's condition. The medical assistant will show you how to perform a hematocrit determination. Begin by sanitizing your hands. Greet the patient and introduce yourself. Identify the patient by full name and date of birth and explain the procedure. Assemble your equipment. You will need a lancet, an antiseptic wipe, sterile gauze, capillary tubes, sealing compound, and an adhesive bandage. It is a good idea to place an extra capillary tube on your tray in case you accidentally overfill or underfill a tube. Open the sterile gauze pack and lie it flat to allow the gauze pad to rest on the inside of its wrapper. Cleanse the puncture site with an antiseptic wipe and allow it to air dry. Do not touch the site after cleansing it. Apply gloves. Perform a finger puncture. Dispose of the lancet in a biohazard sharps container. Wipe away the first drop of blood with a gauze pad. Gently massage the patient's finger until a large drop of blood forms. Pick up the first capillary tube and position it horizontally with the back calibration line facing outward. Move the opening of the tube into the drop of blood. Do not allow the tube to press against the patient's skin, as this closes off the opening and does not allow blood to enter the tube. As the blood starts entering the tube, you can slant the tube in a slightly downward position to facilitate blood flow into the tube. Fill the capillary tube to the black calibration line. Blood fills the tube through capillary action. Be sure to keep the tip of the capillary tube in the blood to prevent air from entering and causing inaccurate results. If an air bubble enters the tube, you must fill another tube. Air takes up space the blood should occupy, resulting in underfilling and falsely low test results. If you go past the black calibration line, you have overfilled the tube. If this occurs, discard the tube in a biohazard sharps container and fill another tube. Overfilled tubes result in falsely high test results. Fill a second tube using the method just described. The hematocrit should be performed in duplicate to ensure accurate and reliable test results. Place a gauze pad over the puncture site and apply pressure. Insert each capillary tube into the sealing compound. Push the end of the tube down through the sealing compound to the bottom of the holder. Capillary tubes must be sealed to prevent leakage of the blood specimen during centrifugation. Check the patient's finger and apply an adhesive bandage if needed. Transport the capillary tubes to your laboratory work area. Now you must centrifuge the capillary tubes in a microhematocrit centrifuge. Open the centrifuge and unlock and remove the protective capillary tube cover. Pick up the sealing compound holder. Before removing a capillary tube from the sealing compound, rotate the tube between your thumb and index finger. This prevents the sealing compound from pulling out when the tube is lifted out of the sealing compound. Place the capillary tube in the centrifuge with the sealed end facing out. This prevents blood from spinning out during centrifugation. Remove the second tube from the sealing compound. Place it in the centrifuge opposite the first tube with the sealed end facing out. Replace the capillary tube cover and lock it securely. Close the lid on the centrifuge and centrifuge the blood specimen for 3 to 5 minutes. Centrifuging causes the red blood cells to become packed and to settle on the bottom of the tube. Allow the centrifuge to come to a complete stop on its own. Using your hands can lead to injury. Open the lid of the centrifuge. Unlock and remove the protective tube cover. Adjust the first capillary tube so that the bottom of the red blood cell column located just above the sealing compound is placed on the zero line. If you do not zero the tube, your results will be inaccurate. Read the result at the top of the packed red blood cell column. The result of the first tube is 40%. Read the result of the second tube in the manner just described. The results of the tube should agree within 4 percentage points. If not, the results are invalid, and the hematocrit procedure must be repeated. The result of the second tube is 41%. Since the first tube is 40%, the tubes agree within 4 percentage points, indicating the results are valid. Next, add the results of the two tubes together and divide by 2 to obtain the hematocrit results. The average of these two values is 40.5%. The normal range for hematocrit for a female is 37% to 47%. For a male, the normal range is 40% to 54%. This hematocrit determination was performed on a female patient and falls within normal range. Properly dispose of the capillary tubes in a biohazard sharps container. Remove your gloves and sanitize your hands. Chart the results. Include the date and time, the name of the test, and the hematocrit results.